We're certainly not having just a bad day, but now we have Julie Cerrone, who is a certified holistic health coach, ePatient advocate, doTERRA wellness advocate, and blogger. And I'm excited to hear what you have to say.
Thank you. Well, first off, I want to say thank you for having me. I love initiatives like this that include the patient's voice. I think it's really important. As she said, my name is Julie Cerrone, if I haven't met you yet. And I am a certified holistic health coach, but I'm also an autoimmune warrior. I have psoriatic arthritis, have suffered from avascular necrosis, and I have kicked complex regional pain syndrome and melanoma, depression, and anxiety cats. So, thriving, right? And as the blogger behind It's Just a Bad Day, Not a Bad Life, I really like to help other patients realize that what they're going through, it's hard, but it doesn't have to be the only thing that you dwell on, and there are a lot of positives in our lives. So it's really ironic that I'm standing in front of you today talking about social media and health. I went to West Virginia University and graduated with a Management Information Systems degree. And for 5 years, I worked for Deloitte Consulting, traveling the country, helping companies integrate their systems, change their business processes. I worked in the healthcare space, public sector, across different industries. But whenever I was sitting at those desks, wherever I was always scrolling through Facebook, wishing that I could have a job, that I got my IT consulting paycheck, but got to do social media. And I actually was forced out on disability about 3.5 years ago. And now, my passion for IT, social media, health is all coming together in a really awesome way. So, and I'm not the only person that's really doing this. So today I really want to talk about the evolution of the patient. You've kind of heard it the last 2 days, but I want to talk you through my evolution, why it's important to be an empowered patient. It's so vital in today's healthcare landscape. Social media connects us all, from the patient to the CEO, and how are we, collectively using that to our advantage? And I want to talk about some ways that maybe we can leverage that, and really how empowered patients not only are helping the patient, but they're also helping the healthcare industry as well. So the evolution of the patient, kind of going through my story, there are many different examples that we could give. But meet Julie, meet. 5th grade, active kid, I liked to dance, play softball, but I was facing my first knee surgery. And at the time, I could have never imagined that one knee surgery was going to lead to a whole life of different health problems. I really relied on my parents to be my advocates. We relied on the doctors to tell us the information that we needed. This was the early 90s, so I don't even think we had a computer yet. So we definitely couldn't just go to Google and search different things. And we definitely didn't think the simple meniscus surgery that I thought I was having was going to end up being a systemic issue. But I have amazing parents, and I really hope that every patient or child out there has amazing parents, because my parents really stood up and advocated for me. My mom is somebody who doesn't just take one word, she wants three opinions. But my dad is someone who always believed what the doctor said, and there's nothing wrong with that because they are highly trained professionals. So we started going through the healthcare landscape, kind of looking at 2 different ways. One of my parents was like, okay, yeah, this is what the doctor's telling us, let's just go in and do surgery, and my mom really questioning things. She started a health record on me the day I was born, and she has honestly written every time I've gotten sick, all my doctor's appointments, and that has served to be an invaluable resource, especially now, so I can kind of look back and connect the dots to really what was happening, because at that point I didn't have that. Fast forward, 24-year-old Julie. At that point, I had had 3 different knee surgeries, had undiagnosed gut problems, so many different fatigue issues. I had gone through so many different tests. Once in middle school, a doctor had mentioned that they thought I had psoriatic arthritis, but since I was going through puberty, they didn't want to put me on any heavy-duty drugs. And that was in the early 90s, and biologics were just hitting the scene, so that was something that they weren't giving to children yet. And again, not having Google, we didn't really think it was that big of an issue. And especially to me, a child, someone saying you have arthritis, I'm thinking of my grandma who had a knee replacement, not that it was a systemic issue. So throughout the rest of my life, my mom kind of held on to that diagnosis in the back of her mind, and every time something happened, said, oh, maybe you have arthritis. But we would get in so many fights because I'm like, Mom, I do not have arthritis. I'm 20 years old, I don't have arthritis. So at the age of 24, I'm still relying on my parents to be my advocates. I'm starting to step out on my own. I have now Google that I can start Googling my symptoms and trying to see, what is attributing what. I'm having more tools at my disposal. And it was really at that point I started to be able to step up and really be impactful in my own healthcare. So now, today, 30 years old, 180 different degree difference from where I was when I was 24 when I look at my health, because I've been through a lot of issues in the last 4 years, and I realized that if I, the patient, don't know exactly what's going on with my body, what my options are, I'm going to get lost in the shuffle. It's just how it is. There's so many pressures today in the landscape, and I realized that I need to rely on my family, my friends, and other patients for support. So why has it really become so vital that we become our own healthcare advocate? Well, we've heard many of these things, this morning and yesterday, but, when we go to the doctors, we're treating symptoms. We're not necessarily looking at us, at the whole body. Very individualized, very siloed, treatment is not individualized. We talked yesterday about step therapy, putting certain patients on drugs right off the bat isn't necessarily the best course of action, and we kind of need to know our options before we just jump in and do something. Healthcare products, very mass marketed. We have commercials on TV telling us if we have psoriatic arthritis, try Humira or Umbrella and things like that. Healthcare practitioners are under extreme amount of pressures. We just talked about how you get about 7 minutes with your doctor and 45 seconds is spent on medication, new medication. There's a lot of crap out there too, medical data. Anybody can be an expert on the internet, right? So there's just a ton of things out there. And patients are feeling very marketed to, and we want to hear personal experiences. So we really need to be empowered because, if we don't, who is stepping up and advocating for us? Last year I had the opportunity to hear Dr. Dan Siegel speak at Stanford Medicine X. His keynote speech was about how compassion and support and presence affect a patient's outcome. And it really can have a molecular change on our body. So being empowered and knowing that we need to facilitate communication between us and our practitioners, or maybe reaching out to who's making our drugs to create that relationship, that's actually going to help us in our healing process. There really needs to be a partnership between patients and our healthcare teams. Genes are only part of the equation, and when we're getting these autoimmune diseases or chronic conditions, there's so many other things that we can be doing other than just taking a medication. When we look at the whole body as a whole, we need to know all of the other things that we can be doing. And like I said, no one else is personally invested in our health. We will get lost in the shuffle. So social media truly connects us all. And I do realize that, maybe I'm not the typical patient. My grandma definitely isn't on Twitter, blasting out things, participating in Twitter chats. But out of the 7.2 billion people in this world, 3 billion of them are active online users. And out of that, 2.1 billion have active social media accounts. That's a lot of people. Social media is connecting patients and patients, CEO and patients, patients with medical device companies, pharma, insurance companies. There's that connection there. And how are patients using social media? These are just 3 examples. On Twitter, there's Twitter chats. And I absolutely love getting on Twitter and participating in Twitter chats because not only are patients getting involved, doctors are getting involved, different medical device companies are getting involved, involved. Technology companies are getting involved, and you're really getting to see a whole picture of what's going on. Instagram, people are posting out motivational quotes to help us get through the day and realize it's not just a bad day. They're posting procedures that they had, doctor's appointment they had. There's even a hashtag hospital glam, you know, how you're looking when you're at the hospital or at your doctor's appointments. It's facilitating these relationships and communication between people. And Facebook is really facilitating discussions and getting different content out there. So, you know, the quiz that we were talking earlier about breast cancer, I mean, if we see that on there, we're sharing it to people because people in my network may be at risk. So there are a ton of different ways that social media are being used, and I could probably talk about it for the whole day today. But I'm going to talk about 3 different key areas. So resources, you know, how they're using it to advance knowledge, finding support, and creating transparency. So resources to advance knowledge. So this is a little personal story about me. So avascular necrosis means part of my left femur bone died. And I guess I should back up. So 3.5 years ago, 4 years ago, I was working and I was in extreme pain. My knees started swelling up. Ended up going out from work. What I thought was going to be 2 weeks recovery, work from home until I could travel again, ended up into 2 failed surgeries, months of spending cooped up in my parents' house on Percocet, feeling like a zombie. And I just kept getting worse and worse. And my doctors were saying, oh, you're just overdoing it, physical therapy. Oh, you're fine, like, don't worry about it. You just need to calm down. I knew there was something else wrong. So I pushed and pushed until I finally got tests. And I will remember the day that my doctor came in the office and said, part of your bone has died. And I just looked at him and was like, what? Like, I didn't even know bone could die, first off. And I just kept thinking, like, you've been telling me for months that this was in my head, that I was pushing myself too much, and here I am, part of my bone is dead. Like, it's not going to regenerate. And then I'll remember what he said next. I know what AVN is. I see it. I have absolutely no idea how to treat it. And I don't know who to refer you to. So I left that office, and I remember crying all that night thinking, what the hell am I going to do? If you ask my dad about that appointment, he'll have some very choice words about that doctor. But so we started looking to friends and family saying, okay, do you know anybody that we could go to kind of get some path of, you know, we have no idea what to do. So through friends and family, found some doctors, started going to these doctors, and I kept hearing the same thing. I know what AVN is, I don't deal with it. I know what AVN is, I would give you a knee replacement, but you're way too young. I know what AVN is, I actually think you should just walk on crutches for the next 10 years until your knee completely collapses and then get a knee replacement. These were unacceptable answers to me, and I knew there had to be answers out there. I knew I wasn't the only person going through this. I mean, people like Bo Jackson had it in their hip, okay? So I knew there were other people out there. So I went to the internet and started just searching avascular necrosis personal journey blogs. And what I found helped me change my entire life. First off, I found a blog of a girl telling me about a doctor in Cincinnati who was finding blood-related problems that were causing this. He worked with me virtually. 25 vials of blood later, found out I have a genetic mutation on my prothrombin gene, and my femur had had a stroke-like occurrence. We were thinking maybe there was a blood clot, the blood got cut off, and that's why it died. Up to that point, every doctor I had met told me, oh, it's just idiopathic, yeah, we'll never know how it died, you know, these things just happen. Bone doesn't just die, like that just doesn't happen. And I knew that there had to be a reason. And because of these personal journey blogs, I found that reason. I started getting a little bit better on blood thinner injections, but I wasn't really getting what I wanted. So I went back out. I started an AVN Facebook group that has 1,600 people in it now, and from those shared experiences, found that there is a clinic out in Colorado doing stem cell and PRP injections. And it's not covered by insurance, so, you know, at first the cost was a little off-putting, but because there were patients out there sharing their experience about how they couldn't walk for a year, and now they're cliff diving in Costa Rica, and they're doing all of these active things. I was pushed to go and get this done. Without these patients, I wouldn't be standing here without my crutches. Actually, for the last 3.5 years, I've been on crutches. I would have never thought about wearing wedged heels to a presentation. This is the first trip I've taken without my crutches in 3.5 years. And today, so on your right here is my femur bone. And this is the avascular necrosis, the biggest part. And on the left there is now 40% regenerated because I found these patients and they really helped guide me to solutions.
Wow.
So I went out to social media to advance my knowledge of what the drivers behind avascular necrosis was and what I could do, what therapies were out there, and so many other people are doing this exact same thing. So throughout my presentation, I just threw in some other people's quotes and experiences because this is so much bigger than I am. I'm just one face in the crowd. My friend Alicia here, she's a psoriasis blogger, and she's using hashtags and her blog to really help psoriasis patients get the information that they need. Dr. Bonnie Feldman is actually using these social media channels to survey autoimmune patients, to bring their voice together, to raise awareness, to really drive research in this space. So the resources of social media are being used to advance knowledge. People are sharing their personal stories. The healthcare industry can listen to these stories. Even if you're afraid to interact right now, be listening. Yesterday when Mark was talking about how they are listening, that's great. I'm so glad to hear that. And I'm really excited that, just kind of see where that goes. Researchers, doctors, healthcare professionals, they're all using these platforms to gain information for their benefit too, doing surveys, seeing how patients are living their day-to-day lives. It's really important to become an expert on your disease, and social media is really helping that to be a lot, to become easier. It's also being used to find support. So I actually spent about 6 months in my parents' basement, in my bed, not being able to move. I couldn't put any weight on my left leg, and it was so inflamed I couldn't put pants on. And it was a good thing I couldn't put pants on because even a sheet on top of my leg would cause me immense pain. I had gone from traveling every single week, this go, go, go lifestyle. I was actually living in Manhattan, and I had to move back into my parents' house, and I was just so depressed. It was not the way I wanted my life to go. Everyone kept living their life, and I was at a standstill. And, people would say, oh, well, you look good despite what's going through, and oh, you have a good spirit. But that's not what I wanted to hear. And it wasn't until I got on Twitter and started connecting with people, and I would hear, oh, yeah, I didn't get out of bed today, too. Or, yeah, me too, girl. I'm having that same problem. I mean, just a relief was taken off my shoulders to know I wasn't the only one out there. So social media is really bringing all of these patients together. Twitter chats ended up being the highlights of my week because I would interact with these people and who were offering tips and tricks and helping me along my journey as well. So people are looking for support. Lorianne actually has become a really good friend of mine, and she found me on Twitter because she was looking for a psoriatic arthritis patient as well to really exchange stories. Natalie I met on Instagram, and she used a contact that she met on Twitter to help her really rein in her migraines and get her symptoms under control and had the support she needed to make dietary changes. These are just two patient examples, but it's awesome when I see a medical device company or someone else out there in the healthcare industry trying to support the people that are using their products. It's really invaluable. So people are using these resources to connect with each other, and the healthcare industry can connect with these patients and give a whole new level of support that you never had before. Patients sharing their stories are directly influencing other patients. So I'm hearing that so-and-so is using this cream and it's helping her joints. I'm going to be more apt to use it because I trust her. She knows what I'm going through, and she's not going to just sell me something that's not going to work. And it's creating transparency like there wasn't before. So I'm sorry, Pharma, but before I would watch commercials and see, oh, if you have psoriatic arthritis, try Humira, or I'd see Phil Mickelson on TV, and I really just cringed because I felt like, oh, I have this medication and we're not going anywhere, we're big pharma. I just kind of felt like a number. I felt mass marketed to. But I can honestly say that taking an active role in social media and being able to participate on patient panels within these different companies, I'm seeing a whole other side that is not being shown to people. And I think that social media is a really great tool to help show that side of you. I'm learning about research and projects that are going on social media that I didn't know of before. I've been able to interact with top psoriasis researchers who are doing groundbreaking work that I would have never known about before. So it's just really opening up the whole space, and everyone's coming to the table and can really create ideas and have that transparency. So two examples of that is the NPF, National Psoriasis Foundation, actually reached out to top bloggers in the psoriasis and psoriatic arthritis space and give us support with our blogs and how to get our social media out there. They're not telling us what to say, but they're supporting us to get our patient voice out there. And they're also helping bridge the gap between us and pharmaceutical companies to really help engage with each other. And Keith, who's actually here today at Your Care Moments, they're using bloggers and social media to get the word out about these surveys that they have that patients can take. They're using that market research for their company, but they need patients. In the end, we both need each other. So social media is really driving transparency because we can all communicate with each other. We can see, there's a gateway to see exactly what we're all thinking. There's absolutely the opportunity to leverage these people's stories. I have absolutely no reservation in sharing my story, and if that's going to help you also get the word out about your product, let me help you. There are patients out there that want to help. It's just creating more personal connections, and patients are feeling way more cared for and supported than ever before. So social media is helping empower patients for their own healthcare journey, but it's also really helping shape the landscape of future healthcare too. There are a few pitfalls. There's a lot of bad information online. Yesterday, when we were listening about the regulatory issues, a great point was brought up that if you're the expert in your drug or whatever area, disease state that you have, if you're not putting out the content, someone else is going to. And you don't know if that's going to be factual, if it's going to, you don't know what that information is going to be. So there's a whole lot of information out there. Social media is driving overconfidence in patients. People have so much knowledge at their disposal. I see it every day, people on Twitter wanting to pick fights with different doctors because they feel like they know more than them. And you're going to have that regardless of social media or not. Our world landscape today is just the information-driven one. But really, technical solutions, they require your time, your money, your effort, but that push is here, and it's not going anywhere. Someone said earlier, pharma isn't too big to fail. If you're not getting on board, you're going to be left behind, and you really can't ignore it. But a change really is happening. Patients are being more included on advisory boards and in conferences like this, and we do feel like our stories are being heard. Some like the BMJ, formerly British Medical Journal, they're partnering with patients. Flip the Clinic is exploring new ways to kind of push the envelope in how patient-centered care is happening. And like I mentioned before about the Psoriasis Foundation with their blogger initiative, people are realizing that there are these top thought leaders out there and that they can be used. My friend here, Alan, actually recently left his job at an insurance company to work for Medicare to help push patient-centered care. So patients are, involved in expressing their journeys, sharing their journeys, but we also really want to help make a difference. So empowered patients really are beneficial for all. They're beneficial for us as the patient, and they're beneficial for everyone sitting in this room, all stakeholders involved in the healthcare industry. So I really love working one-on-one with patients to help them manage their symptoms and realize that you can live your best life despite any chronic illness. But I also feel like I have this duty on my shoulders that since I am able and willing to get out there to help drive patient-centered care, and I'm sitting at this cusp now of getting off disability soon and realizing that, this has been the biggest blessing of my life, all these health issues, because it's pushing me in a completely different path, down a completely different road, and I honestly couldn't be more happy. So if I could just leave you with one thought, social media really is ever changing, but there are some great thought leaders out there that want to help you change the face of healthcare. So reach out to them. Even if it's a simple Google top 10 bloggers in diabetes or top 10 bloggers in whatever disease state, reach out to them. Figure out a way to leverage them, because that's exactly what you need. You need your message coming from patients. So thank you.
Questions?
Thank you so much. You ended on the statement, you need your message coming from patients. As a content creator, you have a blog, you have social outlets. Do you see a certain type of content trending now? Or is there something new that, I'm sure you write blog posts, infographics, kind of all the standards. Is there anything that seems to be more, newer, or a new way people want information?
Right. Well, I've tested on my site, and I do write for different blogs out there, trying to see what's getting more views. Video, for sure, is absolutely crucial. Short videos, people share those like crazy. You're going to get more views.
What kind of video? Is it you? Is it are you giving a little peer-to-peer tip, or is it?
Yes, absolutely. Okay. I would say tips, sharing experiences. So I have seen the best thing to be if you're giving advice, but you're sharing a personal story behind it. So top 10 ways to become more of an empowered patient. And as you're going through that, you're sharing your personal journey of how it's worked. Or, 5 reasons why Humira was a savior drug to me, and then I'm really putting in my information and supplementing some of that with videos. Personally, me, since I am a health coach, I like to put out little tips and tricks for people that you can just add into your life to help manage your symptoms. Because I think that, at least I think that there's so much that you need to do for whole healing. It's not necessarily just taking a medication. And I really like to see, for instance, if a medication's coming out, instead of just a disclaimer like, with a healthy diet or whatever, maybe some tips to go along with it that's going to help make that medication more effective, or it's going to help me feel better and things like that. So, yeah, thank you. Thank you very much.
Next we have the roving Craig Kemp.